What are the symptoms of macular degeneration? Well, macular degeneration has a wide spread of severity, and associated with this there will be a wide spread of symptomatology. In patients with very mild macular degeneration, one of the first symptoms is that they're aware that they need good light in order to read. Often they can wake up in the morning and notice that there's a blurred patch in the centre of the vision which gradually fades, usually over a few minutes. And this is because with macular degeneration, the retina, the photographic film at the back of the eye, and in particular the central part of the retina, which, as I've mentioned in previous videos, is working very hard in order to function to convert light into electricity, takes a little longer to wake up when the eyelids are open first thing in the morning. So immediately on waking, the cells are not functioning as well as they should, and so it just takes a little bit longer for the cells to start working, and this is the reason there is the blurred patch in the centre which fades as the cells get going. People also can be aware that if you move from a light room to a dark room or a dark room to a light room with mild macular degeneration, it can take a lot longer to adjust to this change in light intensity, and that again relates to the fact that the cells, the rods and cones, take longer to adjust to the amount of light striking them. And probably the most difficult thing people notice if they have early macular degeneration and they're still able to drive is that if it's a bright sunny day and they drive through a road where there are lots of overhanging branches and you go from light to dark very quickly, that can be very disconcerting on the eyes because it's difficult for the retina with the macular degeneration to adequately change to the different lighting conditions as quickly as it should in order to still see well whilst driving. So the primary symptom of macular degeneration is central blurring and distortion of vision. The speed of this depends on the type of macular degeneration. With dry macular degeneration, the more common form of the condition, it's usually a gradual process with a gradual blurring of vision, and distortion, although it can be present, tends to be less of a problem. In more severe dry macular degeneration, where there are patches of loss of retinal tissue in the macula, you can get patchy vision with words jumping in and out of an area of clarity. So dry macular degeneration tends to produce a gradual blurring of vision, sometimes distortion, and patchy vision. With wet macular degeneration, it is a more acute process with abnormal blood vessels suddenly developing and growing into the retina, hemorrhaging and leaking, and causing a sudden swelling of the retina. So with wet macular degeneration, a sudden blur and distortion of vision is usually noted. And the distortion of vision is as a result of the swelling developing within the retina. In order for us to have a nice clear view of the world, we need a nice smooth retina to give us a nice smooth view of the world. As soon as you get swelling in the retina, you get a bump in your retina, you get a bump in your vision, and hence straight lines that kink, such as the edge of a door frame or a window frame, telegraph poles or the horizon. But hopefully with treatment of wet macular degeneration, and in particular if it's caught at an early stage, the distortion will reduce as the anti-VEGF injection treatments which are now used allows the retina to reduce in its swelling and go back to its normal shape. There is another condition which is actually very common called Charles Bonnet syndrome, which is visual hallucinations associated with loss of vision, and usually is seen in the more severe forms of macular degeneration, although it can occur at any stage in macular degeneration. We are very much visual beings, and at least 1/3 of all the input to our brain comes from our eyes. So if we have macular degeneration and lose central vision, the brain becomes a bit redundant and it makes up its own images. And these images can vary greatly from simple different coloured shapes to formed visual hallucinations. And I had one patient who had the Archangel Gabriel arising from the bed when she was waking up from sleep, and she thought that the end had come, but it was in fact Charles Bonnet syndrome. So there's a huge spectrum of visual hallucinations associated with this condition, and it's certainly not you going mad. It's a well recognised or even under recognised condition called Charles Bonnet syndrome. They usually gradually fade with the passage of time, and unfortunately drug treatments are not that beneficial, but provided you're aware of that's what it is, patients could grow to accept the condition, and as I say, it gradually improves as time passes.